The Ministry of Health is adopting a new approach in contact tracing in the war against COVID-19. Chief Administrative Secretary Dr. Mwangangi says that with the infection now having taken root in the community, research will have to be used in targeting those to be subjected to test. She spoke as Kenya registered 379 new cases and 19 patients succumbed to the disease.
Challenges in contact tracing of suspected COVID-19 cases has prompted new approaches in a bid to flatten the curve of infection.
Contact tracing, as we did in the beginning, unfortunately is not feasible, and this is the same experience that different countries are having. Africa CDC informs us that perhaps when it comes to contact tracing, when you've established community transmission, you need to relook at your approach because it will be futile. Because the disease is within the community, it has already spread, and contact tracing then, and in terms of its merits, becomes a little bit weaker.
Chief Administrative Secretary in the Ministry of Health, Dr. Mwangangi, however, said the shortage of reagents has been addressed and hence testing capacities will be revamped.
We are not flattening the curve. According to our statistics, our daily summary statistics, our research when it comes to prevalence of this disease, we are well aware that our curve has not yet flattened. Yes, there are challenges when it comes to the daily tests that we're doing. We are experiencing, as we've mentioned, disruptions in terms of reagents, being able to get those supply chains sorted. But this is something that we are managing. Camry, next week, will actually be getting a batch of reagents coming in. And so this situation will normalize by next week.
The Minister of Health is cautioning of an anticipated upward trend in coronavirus cases as Kenya's coronavirus caseload rose to 31,015 after 379 more people tested positive in the last 24 hours from a sample size of 3,867.
We've now established what is known as community transmission. And what this means is that the virus has spread within our communities to the extent where if you are to follow one case within the community, you may not be able to determine a true exposure of that case.
Nairobi continues to take the lead with a cumulative sample size of 18,208. Kiambu comes second with 2,288. Mombasa has 2,234 cases. Kajiado 1,650. Machakos 1,078. Busia 653. Uasin Gishu 407. Migori 361. Nyeri 224. And Garissa 198 cases. 19 more people succumbed to the disease, raising the death toll to 506. One person is said to have died at home, while the other 18 had comorbidity.
Today, we have 244 patients that have recovered from the disease, bringing the total number of recoveries to 17,612. And from the discharge, 76 were from various facilities, whereas 168 were from the home-based care program.
The Ministry of Health advises Kenyans to brace themselves for a long battle with COVID-19 disease, as the disease has already established itself within communities, and this will require adjusting to the new normal, which means that Kenyans will have to continue wearing of masks, staying at home, and washing hands regularly. Purity Museo, Channel 1 News, Nairobi.